Hey, it's Dr. Daniel Jacobazzi from PhyxMe Physical Therapy, and I was going to do a follow-up to yesterday's video. Was talking about prescription drugs, polypharmacy, but going to talk about one drug in particular, statins. So statin drugs have exploded in use, especially ever since they have continued to drop the acceptable level of cholesterol. And now there is a fallacy or an incorrect belief out there that high cholesterol is tied to plaquing. It is not. They're two separate things. Now, plaquing is secondary to inflammation, and inflammation is, again, tied to poor dietary choices. But that's a whole nother discussion. What I'm going to talk about today is the statin. So as I mentioned in the other polypharmacy video, there's no such thing as a shortcut. And so if you're going to take a medication for one thing, it's going to cause other issues. And so specifically for statins, statins interrupt the production of cholesterol. Cholesterol is a basic building block for hormones. And so for starters, and so hormones, especially for men, our chief hormone is testosterone. So it's no surprise, or it shouldn't have been, that with the increased use of statins, that little blue pill for erectile dysfunction made such a big splash. Because if you're knocking down somebody's testosterone, it's going to decrease their ability to function in that manner. Number one. Number two, when we talk about cholesterol, it's of course tied to fats. Our brain is pretty much 100% fat. That's a big deal. And so your body's ability to rebuild itself is going to be hampered when it comes to restoring the brain and repairing the brain. And so there actually are many articles there showing that there is a tie between statins and cognitive decline. And of course, last but not least, nerve pain. So what wraps around our nerves? All of our nerves are protected by something called a myelin sheath. That myelin sheath is made of fats. And so fats, again, the construction can be assisted and aided by cholesterols because it's a building block. And if we don't have that, what's going to happen is that sheath's going to break down. So you can get nerve pain, you can get muscle pain. And for many people with statins, they do notice nerve pain and muscle weakness. And so all of that's related to, or can be related to, statin drugs. And again, the issue isn't that you're not taking enough statins. The issue is that you're making poor dietary choices. So eating paleo, reducing your carbs, avoiding processed foods, all of that's extremely important. And so our program addresses that. It's got a very easy to follow online program, tells you exactly what to do, exactly how to do it, makes life easy. And I know because actually I've done two of the programs in our office and gone all the way through with both of them, and they work. They worked for me. Granted, I was already making pretty good decisions, but it made it even easier for me to make good decisions with the assistance that it gave me. And of course, if I can do it, that means anybody can do it. So I just want to let you know that, again, there's no substitute for a good decision, and shortcuts rarely tend to work out the way we want them to work out. So if you have any questions, of course, send me an email at help@fixmept.com. It'll be in the link below, or give us a call at 773-852-3335. Thank you, and have a good day.